Hi, everyone. I'm Sofia Gruskin, and it's my great pleasure to welcome you to this conversation on why Californians should care about global health. The Institute on Inequalities and Global Health is global in our work, and we're proudly based in the city of Los Angeles, California. And maybe it goes without saying, but we understand global health to be not only about what happens in other parts of the world, it very much includes what happens right here. We really recognize the health of the people in our city and our state are deeply intertwined with the health of people everywhere. And the inequalities that shape health outcomes are both globally produced and locally felt. Racism, gender inequality, homophobia, poverty are all transnational in how they're perpetuated, and that has to be met with transnational action led by the communities who most closely feel their negative health effects. And that's why this event is so important. We're here to try to bridge the global and the local. We hope to strengthen a constituency for global health in the state of California by hearing from two amazing members of Congress from USC's own neighborhood. And to get us going, I'm delighted to introduce you to our moderator, Jonathan Cohen. Jonathan recently joined USC as clinical professor and director of policy engagement for our institute, following a long tenure at the Open Society Foundations. We're thrilled to have him with us. And this event is part of a larger initiative that Jonathan is spearheading for the institute, together with USC's Office of Federal Relations, to translate our research and teaching into global health, into an agenda for federal policy action. And with that, Jonathan, over to you.
Thank you, Professor Gruskin. We could not be more fortunate today than to be joined by two members of Congress from districts neighboring the University of Southern California, Representative Judy Chu and Representative Katie Porter. These two members of Congress are part of a proud tradition of Californian leadership in global health, including that of Speaker Pelosi and Representative Barbara Lee, who have led on every major piece of HIV and AIDS legislation, and without whom we would not have a bipartisan coalition to fight HIV and AIDS here and around the world. Let me just introduce both of them before turning it to Representative Chu to begin the conversation. Representative Judy Chu has been a member of Congress since July 2009, representing the 27th Congressional District, which includes Pasadena and the West San Gabriel Valley of Southern California. She's a member of the Health Subcommittee of the powerful House Ways and Means Committee, and is also a founding member of the Medicare for All Caucus, which is exploring how to improve and expand healthcare for all Americans. Representative Chu chairs the Congressional Asian Pacific American Caucus, and in that capacity, she works to introduce the Health Equity and Accountability Bill each Congress. And as part of her belief that healthcare is a human right, she is also deeply concerned about global reproductive health and committed to permanently repealing the global gag rule and to funding the United Nations Populations Fund. Representative Katie Porter has been the US representative from California's 45th Congressional District in Orange County since 2019. She is a member of the House Natural Resources Committee, which elevates science-based solutions to the climate crisis and protects Orange County families and all Americans from the health effects of climate change. Representative Porter has introduced multiple bills to address skyrocketing healthcare costs for American families, and has also sponsored legislation to hold insurance companies accountable for mental health. She has fearlessly taken on the price gouging behaviors of the pharmaceutical industry and has used her signature whiteboard to grill industry executives in oversight committee hearings and to fight for families' right not to have to choose between paying their medicines and paying their bills. And like Representative Chu, Representative Porter is committed to health equity for Asian Pacific, Latinx, Middle Eastern, and other historically underserved communities, and has co-introduced legislation to include culturally competent and language training in medical schools. I'd like to remind our audience that this event is being recorded and that the Q&A function is open in case you wish to react to anything the speakers are saying. Representative Chu, thank you so much for being here. We're thrilled to have you with us. And let's begin with you. Why should Californians care about global health?
Well, first of all, thank you so much for that wonderful introduction, Jonathan. And Thank you for inviting me to take part in this incredibly important conversation about why global health is important to us here in California. I'm proud that California boasts one of the most impressive healthcare systems in the world. But as the last 2 years have shown us, that's not enough to protect us from a pandemic capable of killing almost 1 million Americans and shutting down our economy. The coronavirus could not be stopped by closing our borders and pointing fingers, which means that if we want to defeat this pandemic and avoid the next one, we need to reassess the way we prioritize healthcare around the world. We don't do this by retreating behind our borders, pulling our experts out of foreign countries, and limiting scientific cooperation. Viruses don't have a nationality, and so neither can our response. And that's exactly how the Trump administration responded by reversing longstanding and bipartisan policies of past administrations to be engaged in global health efforts, like ending the US involvement with the World Health Organization. His choice to pull our experts out of China advanced this narrative that China is an enemy, laying the groundwork for anti-Asian hate here in America. And it certainly didn't do anything to make us safer. In fact, it made it harder to fight this virus by depriving us of early and accurate information on the coronavirus's outbreak and spread. And it made it harder for us to prepare and respond. And by opposing international efforts by the EU and others, we actually hampered global efforts to ensure that coronavirus treatments and vaccines were distributed to all who needed them. This is the exact opposite lesson to have drawn from past pandemics, because while the coronavirus pandemic is unprecedented in our lifetimes for the damage it caused, it's not unprecedented in the risk it's posing. In 2003 with SARS, 2009 with the avian flu, 2014 with Ebola, we faced similarly dangerous threats, but none of them ever rose to this level. Why? Well, part of it has to do with the sheer contagiousness of the novel coronavirus, but that isn't a sufficient explanation when we know that other viruses like Ebola are also easily transmissible. The different outcomes also have to do with our response. When SARS broke out, instead of trying to make it into a nativist battle of who is to blame, the Bush administration offered its support to China in establishing a strong pandemic response system. It established a partnership with the Chinese Ministry of Health, including an agreement to help build China's capacity to respond to other outbreaks. This continued in the face of the avian flu outbreak when we successfully contained this threat, thanks to CDC cooperation with international partners like China to share data and conduct joint research. Similarly, it was thanks to the US working in coalition with the African Union, Canada, China, Cuba, the EU, Russia, South Korea, and others, that the death totals from Ebola were a fraction of what the CDC had originally predicted. In all of these cases, our priority was saving lives, not scoring points, even if it meant working with adversaries like China and Russia. That's because xenophobia and nationalist rage may help stir up a base, but they don't in any way help respond to viruses. But sadly, xenophobia and nationalist rage was the route taken by the last administration, and it did leave us less prepared for this pandemic. That is why in the fall of 2020, I co-led a letter with Representatives Brad Sherman and James McGovern to then Secretary of State Mike Pompeo and then Secretary of Health and Human Services Alex Azar to express our concern with their decision to retreat from global cooperation. We pointed out that the success of our past efforts and urged them also to not only restore this cooperation, but to find new ways to keep us safe. We suggested a number of proposals, including joint research and production of a vaccine, equitable distribution of essential medical equipment, funding for job programs to support contact tracing and recovery, investment in basic public health systems around the world, and a commitment to promoting international coordination to establish resilient supply chains. And I'm thrilled that this letter was signed by over 100 House Democrats. That's a significant amount of support, and it's a testament to how popular American global health leadership remains. And in fact, with the election of Joe Biden, we saw America step into that role again as he made rejoining the World Health Organization one of the very first acts he took as president. Not only did this mean restoring essential US financial support to the World Health Organization, it also means strengthening the organization's ability to collaborate with global partners, which is what we learned from past pandemics is really the only way to save lives. This isn't just important for stopping the coronavirus. The WHO collaboration is vital for things like nutrition, polio eradication, and addressing the threats posed by climate change. The president has also helped increase our support for vaccine distribution around the world, committing to donate over 1 billion doses. Already, the US has sent over 400 million doses to 112 countries, which I'm very proud of. But I also know we need to do better, as this is still just a fraction of the global population. Restricting vaccines to the wealthiest nations only allows the virus to spread and mutate in other countries, which in turn endangers us all. And the longer the virus spreads, the more we are at risk from variants like Delta and Omicron, both of which overwhelmed our hospital systems once again because of a virus that doesn't care one bit about borders. More vaccine access is still only part of what needs to be done to keep us safe, though, because vaccines only address the current pandemic, not the next one. To stop the next one, we need to reinforce health systems and outcomes to make things more equitable. One way we can do that is to address the policies that deny women full participation in society. Because of a lack of family planning and access to quality healthcare, there are approximately 300,000 women who die every year from causes related to pregnancy and childbirth. Nearly all of these occur in low-income areas, and nearly all of them are preventable. That's why I've been such a strong supporter of the UN Population Fund, which is aimed at improving reproductive and maternal health worldwide, and which the Trump administration suggested cutting off support completely. In fiscal year 2020 alone, this funding made it possible for 27.4 million women and couples to receive contraceptive services, for 12 million unintended pregnancies to be averted, and 20,000 maternal lives saved. This doesn't just save lives, it saves millions of dollars in pregnancy-related care and other losses. Because we know that when women have control over their bodies, they have control over their futures, we know that this creates more opportunities for themselves and their families. Restoring this funding after years of attack from the Trump administration is just a first step. Certainly, funding for contraceptive care is no good if local healthcare providers aren't even allowed to talk about all reproductive options. For years, this global gag rule was preventing healthcare workers from saving lives by prohibiting them from offering sound scientific advice about the options available to pregnant women. As a result, so many women have died, and even more have been forced to carry pregnancies to term that they did not want and could not support. That is why I'm so happy that one of President Biden's first acts was to revoke the Mexico City policy global gag rule that ensure the UN Population Fund could resume its important work unfettered by needless restrictions on what advice can be offered. Information can save lives, and it shouldn't be weaponized. Last, even as we invest in better healthcare systems around the world so that other communities are better equipped against viruses and future pandemics, we also need to look at ways we can improve things here. Because sadly, just as we saw around the world, the communities with the most did the best, while those with less access to healthcare or paid leave were disproportionately impacted. So part of buttressing our connected global health system means learning from other countries who have successfully used health impact assessments to identify risks to racial and ethnic minorities who are more likely to be impacted by things like pandemics and climate change. We in the US need to do the same thing here so that we can better understand problems like why certain communities of color are more likely to have asthma. And that is why, as chair of the Congressional Asian Pacific American Caucus and as a member of the Congressional Tri-Caucus, we've introduced the Health Equity and Accountability Act each Congress so that we can close ethnic and racial health disparities here at home. As we look at this pandemic and look ahead to how we can prevent the next one thing is clear, and that is we are only as healthy as our least healthy community. A virus or a variant can come from anywhere to completely change our lives. And so it is incumbent on all of us to do what we can now to help avert that. That means more vaccines, yes, but also more access to doctors and nurses, more accurate information, more preventive and contraceptive care, and so much more. From pandemics to climate change, threats to one community can quickly become a challenge for us all. And so the more we invest in our global health today, the safer we all will be tomorrow. Thank you.
Thank you, Representative Chu. We are off to a fantastic start. I want to thank you for so much, in particular, for articulating with such moral clarity the link between racial equality and gender equality and global health, and indeed all of our health. We're, of course, holding this event during Black History Month. As you said yourself, racism and xenophobia may stir up a base, but they don't solve viruses. We already have a couple of comments coming in from the audience. Emily Sanderson from the Health Global Access Project is picking up on your point about global vaccine equity. She feels that the US support for the TRIPS waiver has been in word only and not supported in action. While meanwhile, big pharma companies continue to post record-breaking profits and suggest we do more. I'm sure Representative Porter will pick up on that as well. We also have a recommendation that you support a letter to the Biden administration in favor of a $1.1 billion in seed funding for a global pandemic prevention fund, as offered by Vice President Harris in September. I think, Representative Chu, if we're going to build a constituency for global health in California and around the country, we need to come to a common understanding of what global health is. So before I invite Representative Porter to respond to you, I want to ask you if you have a definition of global health that you operate under. Feel free to offer that if you wish, or to react to any of the comments that I've shared. Thank you.
Well, I really believe in global health, and global health is about recognizing that what happens in one country matters in every country. Global health is about the type of air we breathe on this planet, the water we drink, the food we eat, and the choices we're making that impacts all of those. Just as diseases know no borders, climate change and the lack of healthcare anywhere affects everyone socially, economically, and in so many other ways. We've seen this firsthand with the COVID-19 pandemic, but it's also true of so many other diseases like HIV, hepatitis, tuberculosis, and malaria. It also means that when the United States fails to live up to our role as a global health leader, there are impacts abroad. Poverty, hunger, and poor health outcomes within our own borders can impact the health of our neighbors and global partners just as much as they can impact ours. So I think it's important that when we look at how we invest in our own health system, understanding that our choices here have consequences abroad.
Thank you, Representative Chu. So this is a conversation. We're delighted to have you in conversation with Representative Katie Porter. Representative Porter, would you like to react to Representative Chu before you give your prepared remarks?
Absolutely. And I just want to pick up on something that Representative Chu has been such a leader on for years and continues to just be tireless on, which is her belief that and her recognition of the reality that abortion is healthcare. And when we talk about a woman's right to make decisions about her body, we have to remember that the risks of pregnancy are not the same for everyone. And we often think about this here, about the risks that women face with pregnancy or reproduction versus the risks that men face with their role in reproduction. But around the world, women face very, very different risks. 99% of maternal and child deaths occur in low-income nations. In some places, the maternal mortality rate is 60 times higher than the United States. And in our Congress, with the leadership of our colleague, Representative Underwood and others, we've been calling attention to our own public health challenges with regard to maternal mortality, particularly among Black women. So I wanted to ask Representative Chu, as you cited the progress that we have made under President Biden in repealing that global gag rule, in trying to move forward, we've also seen here in the United States anti-healthcare actions, anti-healthcare legislation, decisions that remove and restrict and limit women's abilities to make decisions about abortion and to have those conversations be healthcare decisions in conversation with providers. We have seen our own kind of domestic gags put on healthcare providers. How do you think that limits our authority and our ability to operate with regard to global public health, with regard to protecting women? And what have you done here? I know the answer is going to be, I know the answer and it's great. I want everyone to know it, but what have you done here with regard to addressing our own domestic challenges? Because I think there is a credibility. Jonathan talked about the morality of taking the importance of having a strong moral stance when you're trying to lead the world. How does what we're going on here in the United States undermine our ability to lead the world with regard to women's reproductive health?
Well, thank you for that question, Congressmember Porter. But also, thank you for the incredible impact you've had on Congress in such a short time period where you've held so many corporations accountable for their behavior. You have been a true leader and true role model in that effort. So thank you. But I also thank you for bringing up this issue of what our actions here in the US impact our global leadership, because we see that we are taking steps backwards on our full reproductive choices here in the US, starting with the Texas law, which allowed for private citizens to be bounty hunters against others who were seeking abortion, and was the first strike in limiting women's reproductive choices. And we see that this is being followed by a possible Supreme Court decision on a Mississippi case that will be decided in June by the Supreme Court, which could actually strike down Roe versus Wade in the United States entirely. And what this means is that in the United States, the majority of women will experience something that they've never experienced before, where their reproductive choices are cut short. We've had 50 years of Roe versus Wade here in the United States, and it could be struck down, which means that we will have a situation where low-income women in the states where reproductive choice and abortion is struck down will have to travel to other states, but low-income women will have greater difficulty doing such a thing. So that's why I introduced the Women's Health Protection Act, and I've done it actually every Congress since 2013, which would restore Roe versus Wade in each state. It would make it a national right to have abortion as a choice, and it would be doing it in statute. So it would restore women's reproductive rights. So thank you for that. And what it shows is that we have to be an example here in the US for the world. And we certainly know that the decisions here have such an impact around the world. We had a global gag rule, but actually, if you look at it, we had that gag rule here in the US, and it did similar harm here. If we're going to strike it down here, which thankfully President Biden did, certainly we have to make sure that it is not in place around the world as well.
Thank you. Well, thank you both for that incredibly powerful exchange. And Representative Chu, I also really want to thank you for framing the issue of reproductive rights and freedoms as an issue of women's political participation, because we know that when women and girls experience unwanted pregnancies, it interrupts their education, it interrupts their ability to live and work and go to school and exist in the community on an equal basis with others. And let's make no mistake, that's precisely why this is such a political issue. And that is a foreseeable result of things like the global gag rule and the gags that we place on abortion services and information domestically. We know you have to depart at the bottom of the hour. Before we give you a chance to make any concluding remarks, we do want to give you a flavor of some of the other comments that are coming in. We have a great comment from someone with Public Citizen who wants to know whether you support investment in distributed manufacturing for COVID-19 vaccines in hubs in low and middle income countries. I know that's something we'll get to in the second half of the event as well. We have an observation that it's difficult to pass progressive legislation in the House and the Senate when, as one participant put it, it is shaved down. This person has named Senator Manchin and Senator Sinema. Either of you might wish to comment on that. We certainly wanted you to know the comment was out there. But thank you. It is just such a treat to see the exchange, the chemistry, and frankly, the partnership between the two of you, two amazing members of Congress from our own neighborhood in the University of Southern California. And Representative Chu, with that, let me just invite you to make any concluding remarks.
Well, thank you for that. And yes, I do support efforts to be able to get the vaccine out to all of the nations around the world. We know that this is a major impediment to ensuring that all the nations around the world have access to the vaccine. So I hope that we can make more progress on this issue. But I just want to thank you, Jonathan and USC, for holding this event today and for inviting me to be a part of it. It's especially meaningful to have this conversation during Black History Month. Racial equity and economic justice will not be easy to achieve, but I know that we can achieve it. It starts with conversations like today's, and it follows with good policy. So we know that by focusing on the needs of the most vulnerable, by ensuring that we all have access to healthcare, good air and good water and good governance, we can make a healthier world for all of us. So thank you again for letting me be part of this conversation.
Thank you. Thank you so much. And with that, we're only halfway through, and I introduced Representative Katie Porter earlier. Representative Porter, you've already come out with a terrific question in exchange for Representative Chu, but let me put the question of our session to you. Why should Californians care about global health?
Well, thank you, Jonathan, for having me, and thank you to Representative Chu, who is my friend and really an inspiration to me in Congress. When you arrive in Congress, there are parts of it where you see the potential, and there are parts of it where you see the limitations. And Judy is a constant reminder to me of the potential of Congress, the importance of continuing to fight and to be willing to speak up and raise issues that others would like to sometimes sweep under the rug or ignore, including issues of xenophobia, including issues of Asian hate, of misogyny toward women, of mental health. On so many levels, she is such a leader. So, I think that global public health is really about our health. There's an idea, I think, this idea that global health is somehow different from our health suggests that we are somehow not on the globe, and we clearly are. So at its very basic level, I think that it's important for us to understand that our health is interrelated. And that comes both from the fact that we are occupying the same planet, but also from the fact that we fundamentally want to be in interaction with each other. Whether that's a matter of economic interaction, whether that's a matter of social interaction, that's how we are going to continue to engage. Orange County had one of the first confirmed COVID cases in the country. And that happened before we even knew to call it COVID, when we really didn't understand what the disease was. Because that one of those first 3 cases in the country happened in Orange County, I immediately wanted to give the community information. And now, nearly 2 years later, we are still seeing and hearing about the toll that the Omicron variant is having on Southern California. And I just want to take a moment here to acknowledge, not only for those at USC, at Keck, but for around the world, the way that our nurses, doctors, hospital staff, janitorial hospital staff have all been pushed to the brink in everything from setting up surge tents to treat patients, to trying to cleanse and sanitize rooms, ambulances forced to idle outside of emergency rooms waiting for a bed to open, and nurses having to comfort patients who are often alone and separated from our families. So I want to start by acknowledging that it has been a long and difficult 2 years, and for no one more than people who are providing healthcare, often with too few resources, even here in the United States. School absences, as we all know, spiked after winter break. If classrooms even had enough teachers to remain open. Every day I get 2 emails, one from each of my children's schools, and I get to see how many new COVID cases are being reported. And I hope that my kids will not have to quarantine. And so from Delta to Omicron, each new variant should be a reminder of what more we need to do. And instead, what we're hearing sometimes is with each new variant, a sort of effort to say there's nothing we can do. And it in fact should be the exact opposite of that. Each new variant is an opportunity to understand this disease better and to make better and better investments in limiting the harms and risks of the disease. On some fundamental level, we know what we need to do to slow and ultimately stop the pandemic. Accessible testing, high quality masks, and effective vaccines. And as a representative, I have consistently thought about and really pushed others in power to think about how to get those tools to where they are needed most. And that is true both around the world, as we talk today about vaccine justice, but also was very true and still is true right here in the United States. When I learned how much COVID tests would cost for patients paying out of pocket almost 2 years ago, I got a commitment from the then CDC Director Robert Redfield of the Trump administration to provide free testing so that all Americans could know if they had the virus. When I learned recently, and continually, frankly, that patients are still being charged in some instances for tests, I led a letter to the administration calling on them to hold insurance companies accountable. And when I learned that Pfizer was considering raising prices of their vaccines, I demanded answers. In a global pandemic, getting resources where they are needed, both here in the United States and around the world, is not just about doing what's right. It's about keeping all of us safe. And that is so especially true for vaccines, which are our best defense against both illness, but also against the continuation and perpetuation of this pandemic. Our COVID vaccines are medical miracles, and the pharmaceutical industry is quick to remind us of that. And on that point, they are correct. But a medical invention is only a miracle when it reaches a patient. Until then, it is just a potential miracle. And so the reality is that if we keep that technology to ourselves, we will not ultimately protect us from the virus. Right now, we are fighting the 4th COVID spike that has been caused by a variant that emerged abroad. And if we do not do more to help vaccines get to the rest of the world, we could face even more variants, more preventable deaths, and more time for our economy and for our lives that is dominated by the coronavirus. As I've been pushing for increased support for global vaccine access, sometimes I hear people ask, as you said, and we opened, Jonathan, well, why should we invest in vaccines for other countries when there are pressing health needs here in the United States? And here is what I tell them. Getting vaccines to the rest of the world is not just something that we do for people in other countries. It is something that we do to keep our own families healthy and safe. So it is both a moral imperative to protect others, but also at the deepest, most personal level, a moral imperative to protect our own families. Right now, only 5% of people in low-income nations are fully vaccinated, and that is compared to about 71% in high-income nations. That is bad public health, and the science backs it up. Researchers have found that this level of vaccine inequality might decrease mortality in high-income countries like the United States for maybe a year, maybe two. But just like with Omicron, our vaccines will become less effective as new variants develop, and they will continue to develop if we have this level of vaccine injustice. We need to be absolutely clear that even with new variants, vaccines are working and they bring down rates of hospitalization and serious disease. But if we fail to share vaccines with the world and cannot stop new variants from emerging, we are losing our best weapon for ultimately not just slowing the pandemic, but ending the pandemic. Our global vaccination strategy, or really, to be honest, our lack of strategy, is not sustainable. Like too many things in Washington, mismanagement and corruption are unfortunately big parts of the story. We cannot entrust our public health to private companies that view the pandemic as a business opportunity. Manufacturing plants like Emergent Biosolutions, which I'm investigating as a member of the House Oversight Committee, cut corners on safety and ruined millions of vaccine doses that could have saved lives. Instead of spending money to address safety issues, Emergent doled out cash to executive bonuses and spent millions lobbying Congress to keep its government contract money flowing. And I am committed to getting to the bottom of Emergent's mismanagement that threatens all of our health. But that is not an isolated failure. Just this week, we learned that Johnson & Johnson shut down the only plant making usable doses of its vaccine. And that is just the latest problem for Johnson & Johnson, which produced only 40% of the 1 billion vaccines that it promised to deliver in 2021. But that didn't stop the company's CEO from bragging to investors last month about jacking up prices on its vaccines after recording billions of dollars in sales. Vaccine manufacturers have failed to provide a steady, predictable stream of vaccines to low-income nations. By dumping excess doses on countries with no notice, vaccine manufacturers are letting millions of doses expire before they can get used. And the result is that people in low-income countries cannot get vaccinated. The facts are clear. The voluntary donation system that we have right now is not working. When our global vaccine efforts fail, everyone in California is less safe. We need a new plan, and I have some ideas. The mRNA technology behind our most successful vaccines was developed by companies that benefited from decades of publicly funded research. Taxpayers like you and me helped pay for billion-dollar contracts with Pfizer and Moderna. But those companies have refused to share their technology with the world, even though it is the most obvious way to keep us all safe. Instead, they are keeping it to themselves and they are cashing in. Pfizer just announced that it expects to make $32 billion in sales for its vaccine this year. We helped pay for this vaccine technology, so we should get a say in how it's used. I've been pushing, along with Representative Chu and others, pushing the Biden administration to use more of its tools to boost vaccine manufacturing. Getting vaccines to other countries is a matter of national security. And that is why I joined my colleagues to urge President Biden to use the Defense Production Act to license the mRNA technology behind our most effective vaccines. The Defense Production Act would help us scale up manufacturing quickly and meet the world's vaccine needs. We need to cut out the corporate greed that is prolonging this pandemic. There should be public control over public health. And I am pushing for this administration to set up public sector facilities, like was asked about earlier, so that we are not beholden to companies that are interested in their bottom line rather than in keeping families safe. What we are experiencing with the Omicron variant is devastating. We are facing a variant that bypasses some of our defenses and has infected tens of millions of people. This is not our new normal, but it will be if we do not take steps to increase global vaccine access. That is our choice, and the time to make it is now. It won't do us any good to hoard vaccines that protect against yesterday's diseases. I also approach public health from my perspective as a mother. I have 3 children, and nothing is more important to me than their well-being. I want them to be safe from COVID-19 in their schools, and I want them to be free to enjoy all that life has to offer. Overcoming this pandemic is critical, and investing in global public health is not just the best way to do that, it is the only way to do that. When I think about my children's health and future, the pandemic is not my only concern. Raising kids in Southern California means I am constantly thinking about how climate change threatens their health. What we have seen with California is wildfires. We've seen that the climate crisis is creating a health crisis. Insect-borne diseases have become more widespread, for example. Asthma rates have skyrocketed. Extreme weather threatens our global food supply, forcing entire regions to grapple with food and water insecurity. The harms of climate change are concentrated in low-income nations, but we are also experiencing the dangers here in California. It was 90 degrees in Irvine yesterday. Looks like it's going to be 90 degrees again today, in the middle of February. And this type of extreme heat can lead to skyrocketing heat-related illnesses. Extreme heat killed an estimated 3,900 Californians in the past decade alone. And we know who dies in extreme heat. Older Americans die in homes they can't afford to air condition. Workers die in the sun doing jobs they can't afford to lose. The patterns are not random, and they reflect the racial and income inequality in our country. We need to act to fix that. In California, we know the urgent need to take this bold action. Right now, firefighters are working to contain a wildfire about 6 miles from my home. We had air quality problems yesterday. I went for a walk and coughed afterwards. Across our state, we have seen year after year of these record-breaking wildfires, and we know that we no longer have a wildfire season. We have a constant harm and a constant risk of loss of life and devastation. Wildfires are catastrophic public health events because they poison the air, they damage our lungs, they displace families, and they make it nearly impossible to access healthcare. They even cause an increase in car crashes by decreasing visibility on the roads. No country is going to solve the climate crisis alone. And after 4 years of being part of the problem, we're now working with the world to find solutions. As we all know, under the Biden administration, the US has rejoined the Paris Climate Accord to work to limit global temperature increases. If we do not meet that commitment, we will potentially lose another 4.5 million people to premature deaths and have 3.5 million additional hospitalizations just over the next couple years. Taking action against climate change is not just about being good for our health, it also saves us money. The American Lung Association estimates that reaching zero emission transportation by 2050 would reduce air pollution and save us $72 billion in healthcare costs. Meeting the Paris Accord targets would lead workers to take 300 million fewer days off work over 50 years. And that is a $75 billion boost to productivity. As we've seen with supply chain issues and the pandemic, a healthier workforce means a stronger, more stable economy. When the world is healthy, California is healthy. I've often said that if Congress had a motto, it would be something like solving yesterday's problems tomorrow, maybe. And as I've talked about today, we need to make investments in global health now, before the next variants emerge, before the climate crisis becomes utterly irreversible. This is not only the right thing to do, but it is the smartest, most fiscally responsible thing that we can do to keep our families safe. I want to thank everyone for being part of this conversation and turn it back to you, to Jonathan, to have some questions.
Representative Porter, we cannot thank you enough. And it is so apparent how you feel, even viscerally as a mother, the way in which the health of the whole planet shapes and determines the health of you, your children, your family, your constituency, this whole country. I have a number of questions for you. I want to start by asking you a question about global vaccine justice. You said very clearly, we cannot entrust our public health to private companies who see the pandemic as a business opportunity. And yet, as you know, many advocates have pointed out that that's precisely what the Biden-Harris administration seems to be doing. And some people feel that their relationship with, their reliance on the pharmaceutical industry is not only ineffective, but frankly is politically risky, that it's a historic mistake that could cost the president and the vice president politically. You're a politician, you have fearlessly taken on pharma. What's your take on that?
Well, I think the reality is that for too many of my colleagues, the lens through which they view the pharmaceutical industry is a lens about what pharmaceutical companies can do to help them stay in office, rather than asking what pharmaceutical companies can do to help all of us be healthier. Over 2/3 of Congress members cashed a check from Big Pharma running up to the 2020 election. We have only about 11% of Congress members who refuse, as I do, corporate PAC donations, and there are a whopping total of 6 members of Congress, and I am one of them, who refuse lobbyist donations. And so the federal government's solutions for global vaccine access have all enriched Big Pharma. So if you look at our vaccine donation program, it functionally lines Big Pharma's pockets. And along the way, by the way, maybe a few people around the world, a fraction of those will get vaccinated. But it really is a plan that is written from the perspective of what would Big Pharma be willing to do, rather than asking what do we need to do to protect ourselves and the world, and then what is Big Pharma's appropriate role in that. Pfizer plans to make $30 billion, as I mentioned, on COVID vaccines next year, but it's not like Pfizer is giving away hundreds of millions of doses. The government is buying them and giving them away, even though, as I mentioned, we as taxpayers paid for a lot of that research. So I think that it's really important that the government step in and use the existing tools that we have, including the Defense Production Act, including setting up more public manufacturing sites around the world. I'm proud that the Biden administration stood up to Big Pharma and supported a temporary waiver of vaccine intellectual property rights. But the reality is COVID is not, and public health is not a temporary challenge. It is a long-term challenge. And long after COVID is gone, the next pandemic will be knocking, will be coming, we will be at risk. So I think we need to use this moment to stand up to Big Pharma, and then to build a new set of rules that thinks differently, fundamentally, about what is the private-public partnership that we make when we as taxpayers fund basic science and research. And those are not our research dollars are not simply, we're not giving it to companies so they can make money. We're giving it to companies so they can make discoveries. But if those discoveries ultimately don't come back to benefit our country and all taxpayers, and we need to invest in global health to protect us all, then we're not really getting the return on our investment that we are supposed to. So rather than spending so much time worrying about Pfizer's bottom line, I think we ought to be spending more time thinking about the bottom line of taxpayers, of all of us who are paying for this kind of basic science research. So I'm a big advocate in public research. I'm a huge believer in it. And the United States is very, very good at it. What we are not good at compared to some of our competitor nations, including, and I'm not trying to pander, Jonathan, but including Canada, since you are a native Canadian, we're not good at getting our full return on those investments in science. And I think I hope that this is an opportunity to really ask those questions about how do we create structures that create public-private partnerships that make sure that it's truly a partnership rather than a giveaway to big pharma. And the political power of big pharma is very, very real. But I think the American people understand that pharmaceutical companies are companies. They're going to pay attention to their bottom line. That's their job. It's our job as elected officials to pay attention to the health and well-being of people around the world, most particularly the people we represent. And we simply can't do that by allowing pharma to write the rules and to have their way and to control every single policy. So I think the Biden administration has taken a good step with the temporary waiver, but there is more that we need to do. And if we're not going to do it now, if we're not going to do it in this moment with the mRNA vaccines, with the pandemic, with the global public health emergency, when will we stand up to big pharma? When will we rewrite our healthcare rules to make them really work for improving patient care and improving health outcomes? The time has to be now. This has to be the moment. And I think we're in real danger, frankly, of letting it slip away. I think the next 3 to 6 months, for those of you who are on the ground and are in this fight, the next 3 to 6 months is so critical as we push forward, trying to reset kind of how we think about our relationship with big pharma.
Thank you, totally. And since you mentioned it, and it's relevant to this, as of November, I'm also a proud naturalized citizen of the United States. And as someone who votes here, I am very concerned about the campaign finance issues that you mentioned and the fact that so many of our politicians have been bought by the industry. And you're reminding us of something that people who work in public health need to be aware of, which is that campaign finance is a public health issue. Campaign finance is a public health issue because it determines whether our elected representatives structure those public-private partnerships in a way that delivers health as a human right and a public good. And we are not the only country that faces this. Every country is in negotiations at the table with the pharmaceutical industry, and their citizens are counting on them to hold the line and negotiate with industry in a way that delivers on the right to health. I also really want to take you up on the compelling comparison, Representative Porter, that you made between COVID-19 and climate change, and in particular wildfires. And what strikes me about those comparisons is that COVID-19 and wildfires are both respiratory issues, aren't they? I mean, they both affect our ability to breathe. They both affect our right to breathe in different ways, of course, but we also know that the way in which they affect people's ability to breathe, it's not equal, right? It's patterned by racism, by all kinds of inequalities. So wondering what you make of that comparison, and more broadly, Representative Porter, what more can we do to ensure that all people enjoy their human right to live and breathe in a healthy environment, regardless of their race or any other factor?
Yeah, I mean, you're absolutely right that the people hit hardest by the health harms of wildfires and by pollution, industrial pollution, to use two other examples, are the same people who have been hit hardest by the COVID-19 pandemic. Older Americans, low-income families, people without affordable, accessible healthcare, people in healthcare deserts, the disabled community, people with higher risks of chronic conditions like asthma or pulmonary diseases, and those are disproportionately Black, Indigenous, and people of color in our country and in many instances around the world. And so the people hit hardest by the health harms of wildfires are the same people who are hit hardest by the health harms of climate change and the health harms of COVID-19. The transition to clean energy will not only help us protect against climate change and help reduce the risk of wildfires, but it's also going to help us address some of those harms caused to communities of color by fossil fuel infrastructure, that industrial pollution. People often talk about Cancer Alley in Louisiana, but there are cancer alleys, highways around the world in different places. And so one of the things I've done is in my role as chair of the Oversight and Investigation Subcommittee for House Natural Resources is try to look at some of those places where we are creating public health hazards because of our use of our natural or misuse, abuse in some cases, of our natural resources. So I investigated a coal plant located outside Guayama, Puerto Rico, and it is poisoning communities of color. 1 in 3 residents of Guayama has been diagnosed with respiratory disease. And that is absolutely deadly, especially during a pandemic like COVID. The Environmental Justice for All Act is one of the Natural Resources Committee's top priorities. And our chair, Chair Grijalva, has been really wonderful in championing this bill, but also really went through an amazing process to draft the legislation that I think creates a model for how we might think about coming up with future legislative initiatives, including in public health, but went through a process where community advocates and others were able to weigh in and be in conversation as the Environmental Justice Act for All was written. And the result is that it is a bill that is directly responsive to those who are being hurt and who the bill seeks to help. And it's a commitment then to public health and to tying together environmental and racial justice. And that commitment, by the way, the Environmental Justice for All Act looks here domestically at the United States, but we have to also look beyond our borders as we think about the relationship between public health and environmental justice. From 1946 to 1958, that 12-year period, the United States conducted 67 nuclear tests in the Marshall Islands. We deceived the Marshallese. We used them as guinea pigs to study the effects of radiation. We turned ancestral lands into dumping grounds for nuclear waste, and there needs to be justice for the Marshallese and U.S. accountability for the nuclear legacy. To this day, the United States has not conducted the environmental monitoring that we promised to do and is now refusing to discuss the nuclear issue with the Marshallese. And so this is an example, one of many, in which the United States has had an effect not only on sort of the most traditional kinds of public health, but our dependence on fossil fuels, our dependence on military action, our military industrial complex has created created communities of color and places around the world that are being poisoned or have been harmed or are being jeopardized. And so we absolutely have to commit to asking these questions, to making these connections. We have to I talked about public health as a national security issue because it can result in the displacement of people, the instability of government, the disruption of society and the global economy. And the exact same thing is true about the climate crisis. And so I think it is really important to think about when we're using such significant resources for national security in this country, are we understanding that public health and the climate crisis and the wedding together of those two things also present grave national security concerns? And are we directing those dollars that way?
Just another reminder of just how interconnected every issue is. I want to give you a chance, Representative Porter, to make any concluding remarks before I turn it over to my colleague from Washington to conclude the event. Before you do, I really want to acknowledge the amazing comments that are pouring in from the audience. We're going to share those with you and your staff. Thank you, everyone, for your engagement. This has so exceeded our expectations. Never doubt the leadership of California in global health. Representative Porter, any final words from you before I invite my colleague to conclude our event today?
Well, I just want to thank everyone who is on this call today, and hope that you will encourage others to, to watch this, to think about this. I hope you will say the words global public health to your elected officials at every level of government, from city council to the president. Jonathan, when he asked me to do this, I said, we just don't get a lot of constituent engagement on public health. But then we began to talk about it. He said, well, do you get a lot of constituent engagement on climate change? And I was like, every day and twice on Sundays. And he said, well, then you get a lot of engagement on public health. So there is such an important role that each one of you on this call, along with, of course, USC and the Institute for Global Health plays in trying to highlight and elevate people's understanding of what public health is and why it matters. And I think the frame for this conversation, why does the health of people around the world matter to me and to my health, is a very, very important question for us to ask ourselves. So I just want to thank you for convening it, and thank you for continuing to bring these people in conversation. And I want to encourage everyone on this call to be noisy, to educate, politicians and elected officials respond to what our constituents talk to us about. And there needs to be more conversation about public health.
Thank you. You heard it, everyone. And over to my colleague, Flannery Gagan from Washington to conclude today.
Thank you, Jonathan. This has been a fantastic conversation. And on behalf of USC, I want to thank Representative Porter and Representative Chu for their leadership in global health and for joining us today. I have the privilege of running the USC's Office of Federal Relations, which acts as a primary liaison between the university and our partners on Capitol Hill and in the agencies here in Washington, DC. I know our office is delighted that this event marks the beginning of a new effort at USC working with the Institute on Inequalities and Global Health to foster federal policy dialogue on these very issues. USC has a long track record of federal policy action on a range of issues, and global health could not be more timely with COVID-19, climate change, and all of the challenges and opportunities discussed here today. So please stay tuned for future USC events that explore this intersection of global policy, global health, federal policy, and the people of California. We invite you to be a part of this effort. We need you, as you've heard here. And I wish you all a wonderful day and weekend, and extend my thanks and gratitude again to our members of Congress who are here with us today. Thank you all.